Pleasure to see you, and thank you very much for agreeing to be a part of this interview. You are an associated professor of neuropsychiatry at Sao Paulo Hospital in Milan, and as you know, one of your main interests is Rett syndrome. Since last year, you have also been a member of Scientific Advisory Board for Rett Syndrome Europe. Obviously, you have a lot of experience in clinical work with our children, so I will ask you for a few questions for a start. What are your first words to parents when diagnosis is confirmed? And how often do your patients have scheduled appointments after diagnosis?
Oh, thank you for inviting me, first of all, for this interview. And, I've got a quite long experience in children with Rett syndrome. So when I usually see a patient, especially if she's a girl, with a suspected diagnosis, I try to prepare parents for the diagnosis because, it's a clinical diagnosis. So as doctors, we tell our suspect to the parents, but then we usually ask for a genetic test for confirming the diagnosis. So this is quite, I think, quite a difficult period for the parents because they are informed of the suspicion, but they hope that it's not true. So it's very a difficult period for them. When the diagnosis is confirmed, I tell them about the characteristics of the syndrome. In my opinion, it's better to know what is going to be the life of their children, their girl, and also their lives, because this kind of a diagnosis changes the life of the people. But I try to underline the positive aspects of knowing what is going to be their life. So what we can do to help the children and to help also their quality of life. And of course, usually we give a scheduled appointment after diagnosis, usually not so far from the first appointment when we communicate the diagnosis, 2 or 3 months usually, because parents need time to accept the diagnosis, to think about it, and then a lot of question comes out. So I think we should give the time to reflect and then to ask for other things.
Yes, thank you very much. One of the most fierce parents, newly diagnosed children, is epilepsy. You are an expert in this area, so could you tell us, please, something more about epilepsy in Rett syndrome? Are there any similar conditions that can be mistaken for epilepsy? Do you think Rett episodes are a thing? Or is it just a case when clinicians are not be able to identify what is going on?
Epilepsy is very fearful for parents in Rett syndrome and also in other conditions, because epilepsy comes without any previous sign, and so it's really unexpected, and it's something that is very fearful. So Usually we communicate to the parents since the beginning of the diagnosis of Rett that seizures can come, and usually they come around the age of 4, so as a mean age, but of course everyone is different, every individual is different. This is true for people with Rett and in other conditions, of course. And fortunately, we have specific medications for seizures, and now we know which kind of medication is safe and is right for children with this condition. So parents should know that we know which is the medication that works in their children. And Rett syndrome, as other genetic conditions, can be a challenge because in general, individuals with intellectual disabilities and complex diseases maybe have some behaviors that are not easily interpreted by clinicians, by the parents, and so on. There are lots of paroxystic episodes, so brief episodes lasting seconds or minutes that can be misdiagnosed as epilepsy. And in Rett syndrome, some behaviors with motor components, with breathing components, or just emotional and flashing aspects can be misinterpreted as seizures. So it's true in other conditions, but in Rett syndrome is specific of this condition. And as experts in Rett syndrome, we know that this could happen. And I think we should explain to the parents in order that they can be aware of this condition. And when it's necessary, we should record the episodes and try to understand a little bit more.
Yes, thank you. Neurologists are the first link in the chain for treatment children with Rett syndrome, but this complex condition needs a multidisciplinary team. Could you explain to us, please, which specialists are needed to adequate monitoring this condition?
As I said before, Rett syndrome is a complex condition, and we, as clinicians, we know that we should work together because it's a work that needs a team with children with this genetic condition. So when they are children, we usually work with the pediatricians, of course, with dietitians for the nutritional aspects of the disorder. We usually work with specialists in gastrointestinal problems. That can be a pediatrician or a doctor for the adults, and also with the rehabilitation team, which is made of the physiatrics, the physiotherapists, speech therapists, and all the people needed for the rehabilitation of the child. When the child grows up, I think that we should also have in our team a doctor who specializes in bone disease, because one of the problems are osteopenia, and we have to decide when and how to intervene. Of course, sometimes it's orthopedics for the scoliosis, sometimes it's physiatric, it depends. Here we have a multidisciplinary staff in which there is an internal doctor,
Yes,
and also a surgeon, because sometimes girls with or women with Rett syndrome can have abdominal pain for gallbladder disease or frequently gynecological problems, so we also need a gynecologist. And so only a multidisciplinary team can help to understand what is going on. The neurological and neurobehavioral aspects are important, but we should also be aware that the first things to keep in mind is the organic problems. So everything should be checked before saying it's a behavioral problem.
Okay. You developed a recommendation for the diagnosis and management Rett syndrome at all ages. Tell us a bit more about that, please.
Yes, I was just saying that when girls with Rett grow up, they need different kind of examination in order to monitor their condition. These examinations are not needed very frequently. It depends of the country, of course, of the characteristic of the health system, but we recommend this kind of observation every 1 or 2 years. So they should be monitored from the cardiological point of view, from the gynecological point of view. We also have to look at the teeth health as another condition. And so the global health situation should be kept in mind. And we also have older women with Rett. As you know, unfortunately, there is not a problem with aging in people with Rett. So when they are in their 40s or 50s or 60s, they should be monitored as every other individual. So we should keep in mind that, of course, yes, they have Rett syndrome, but they are individuals as all the others. So we should think about it.
Yes, definitely. And one question, Aglaia, just out of curiosity, where did your interest for Rett syndrome come from?
Oh, yes, this is an interesting question. I started working on Rett syndrome, I think around 2005, something like that, because you know, I'm a specialist in epilepsy, and so epilepsy is one of the main problems in people with Rett. And in Sao Paulo Hospital, we had a big center for epilepsy. And then the people from the Rett Association in Italy was trying to organize a multidisciplinary team in the north of Italy, and they proposed me to know a little bit more about Rett. And so I went to the US, to the United States, to Dr. Baden Clinic in Portland, in Oregon. And she was very kind with me. She showed me how to manage the girls. And so I learned a little bit more about Rett syndrome. And then when I came back, I started to build this clinic. And I think that people with Rett are very special. And even if they cannot speak, they can communicate a lot. And so my interest in that condition grew up, because I think it's a challenge to try to understand, to come in a feeling with them and try to do something for them. And
yes, it's nice. It's really nice, because I also think that Red persons are really special. Thank you very much. Now I will talk with you about researching. You have a lot scientific papers, and one of the last ones is I must to read phenotypes in Rett syndrome and insights into healthcare transition. Could you tell us what were your conclusions here?
Yes, of course. This paper was the result of our work, this multidisciplinary work at San Paolo Hospital. And we looked for the numbers of patients, of adult patients, who had had a transition, so from pediatrics to the adult clinic. And we found 50 patients, so a quite important number for a rare disorder. And we wanted to see which were the main problems. And we found that, of course, epilepsy remained a big problem for adult people with Rett, but also other neurological problems. I mean, the motor aspects, only 10% of the patients keep their ability to walk alone. So motor problems are one of the main problems in the adult population, and also sleep and behavior. We also underline that adults with Rett have gastrointestinal problems, and these gastrointestinal problems are also associated with bone health. So the issue about nutrition and osteopenia should be always monitored in adults. In order to do this work, we think that a physician or a nurse should be the clinical case manager in order to help families to monitor these aspects and also to remind what to do. This is true especially for adults, because parents can follow their children, but with age time passes for everyone. So it's very important to identify someone who can help the families when when the individuals grow up.
Yes, yes, that is definitely true. 2 years ago, you published a very interesting study called transcranial direct current stimulation combined with traditional rehabilitative techniques, and it has not been widely applied to Rett syndrome. What is mean transcranial direct current stimulation? And would you be happy to share with us results of this study?
Yes, of course. This study was planned and conducted in collaboration with Professor Fabio, who is a psychologist, a cognitive psychologist, who worked a lot on Rett syndrome. And she wanted to apply this new rehabilitation technique, which is transcranial direct current stimulation, TDCS, which is a method usually applied in people with a stroke, with dementia, with motor deficit consequent to stroke, which has been proven to be efficacious to increase and to maintain the results of the rehabilitation. So this technique had been associated with the cognitive empowerment. In this work, specifically, we identified two groups of Rett patients. In one group, the cognitive impairment was associated with the TDCS, and in the other group, patients followed only the cognitive empowerment. And this technique is usually applied with low intensity current, which is applied to the scalp of the patients. It lasts 20 minutes, so it's not so difficult, but it should be maintained every day for at least a week or 10 days. So this rehabilitation is with a high intervention in a small period of time. And we focus on the language abilities and attention, and we found that the individuals who received this stimulation had an increase in their capacity to reproduce sounds. So it has a positive effect on the language and also on comprehension. Besides, we also found changes in the EEGs, in the waves that we see on the EEGs. It's a little bit difficult. And this is just a result of the stimulation. It would be nice to expand this kind of studies in order to further improve the cognitive rehabilitation in people with Rett. I know it's not simple because we need specific technologies, machines, and also human resources to do this kind of study. But I think this is another aspect of Rett syndrome, which is very interesting. We know this is a genetic condition. It's very complex, but specific rehabilitation can improve the condition of the individual. So I think that more research should be carried on this aspect.
Okay. As we already know, gut's microbiome has very important role in global health, and I found that you have some study about Rett syndrome and it. Do you have, can you give to us some practical recommendation, such as dietary intervention or pre-probiotic supplementation for a person with Rett syndrome?
Thank you for this question. This is another field of research in which I trust. The relationship between gut microbiome and brain is rather new, and because only in these few years we had the possibility to study the composition of gut microbiome with the advance of the next generation sequencing, and so we have the techniques to understand what is going on in our gut. From a clinical point of view, in my experience, lots of parents report a correlation between the gut health and the general condition or the seizures of their children. This is true in Rett syndrome and also in other conditions. So, because I think that it's very important to listen to the parents, because they observe every day their children. And in my experience, they are frequently right in what they see. But we as researchers, as people who work with science, have the responsibility to understand what parents say and try to give an explanation, a scientific explanation of what they observe. And so we know that in people with Rett, there is an important link between the gastrointestinal problems and the seizure or the neurological condition in general. And we made a pilot study on a small number of people with Rett, and we saw that their gut microbiome composition was different from controls. And this finding was also reported by other groups afterwards. So I think that we have to understand the differences, because maybe we can intervene with prebiotics or probiotics. Many individuals with Rett syndrome already take this kind of supplementation because they need it for their intestinal problems. And in the near future, I hope that we could also recommend some diet indications, because nowadays when we studied the diet that parents give to the girls, very frequently we found disequilibrium in the nutrients. And so maybe we should help families to better feed their girls.
Yes, that is really important Thank you. And for the end, do you have some message you would like to convey to parents of children who have Rett syndrome?
Wow, this is very difficult because well, it's my work, so I do every day communication with the parents, and what I try to do is to give them a hope that future of people with Rett may be brighter than what we see today. I'm not a person who sells lies, so I don't think that tomorrow we can change everything. But I gave you some examples of research field in which we should work because the results are coming. So I think that in a few years we could understand and so give advice to the family to how to treat their children better than today. So I think that we should reinforce the hope of the families.
Yes, that is true. I hope that tomorrow really will be better than today for all person with Rett syndrome. Many thanks, Aglaia. This conversation was informative and looking forward to see you soon. Okay.
Thank you, Bojana.
Bye bye.
Bye bye.
Bye.